So there's a lot of utility in DEXA scans. There's utility in the first time that we do one to understand where somebody's at, because there's a lot of information to gather there. I find the most utility in them sequentially, tracking them over time, seeing how interventions, exercise routines, GLP-1s, HRT, if it's improving the body in the way that we're trying to. That is ultimately the most useful way to use a DEXA machine. But the first time somebody comes in and gets a DEXA scan, besides the bone density, understanding the body composition at its core components. And so we can tell everything from the amount of muscle to the amount of fat, the distribution of the fat, the distribution of muscle between one leg and the other to see if there's asymmetries. There's a lot of stuff to read in the tea leaves, but initially my eyes will go to the muscle mass. And yeah, we can look at the raw amount of muscle mass, maybe not that helpful. We can look at things called fat-free mass index, or one thing that we look at a lot is something we call ALMI, which is appendicular lean mass index, and that looks at the amount of muscle on the arms and the legs. Well, we've got a good ratio that somebody should have for that according to their height, to give us an indication whether they're have too much or have not enough muscle, or at an adequate amount of muscle. Next is the fat, and my eyes go straight to the visceral fat, because there are people with 40% body fat who don't have very much visceral fat, and there are plenty of guys with 25% body fat whose visceral fat is too high, and so you never quite know. But it is that first insight into metabolic health. If there is a bunch of visceral fat in there, what is going wrong otherwise that is driving a lot of this? Something is off, and you need to find it. On a DEXA scan, you're getting more accurate reads into the amount of muscle, fat, etc. So it allows you to do just a better calculation of what somebody's metabolic rate may be, how many calories they require per day. I'm still a fan of just measuring that directly with a resting metabolic test, but you can get some more, you can get some decent data from that, and then obviously bone density. But you asked besides bone density, so. The difference between regular fat or subcutaneous fat or body fat percentage, look, that's the fat underneath our skin tissue. It's where we generally store our excess energy in our subcutaneous fat. Some people have a more natural ability to store fat beneath their skin. Some people aren't supposed to be very fat people at all, right? And so basically when our fat stores run out in the subcutaneous area, our body will start to shunt some of that storage of our fat inside of our abdomen. So what does visceral fat tell me? It tells me that we're starting to max out our body's ability to store fat. And so we've hit the limit, we need to come back. And the fat that accumulates inside the abdomen is the same fat that's accumulating in the liver. It's the same fat that is sometimes accumulating around the pancreas and the heart, driving all types of inflammation and issues downstream from that. I don't think I have to expand too much on why that's a bad thing, but the increase in visceral fat tells me that we are at such an excess energy overload that we need to do some things to bring it back. Yeah, we increased the DEXA scan frequency in our patients on GLP-1s and HRT. For GLP-1s, it's pretty simple. I mean, we are sequentially monitoring their body composition to notice the big trends in their weight, in their muscle mass, and in their fat mass. Those primarily what we're looking at. Not too much. It is the gold standard. There are some fluctuations in hydration which may cause more radical changes that aren't so accurate in some of these lesser scans, and so I like to know the ground truth there. But pretty simple. We're monitoring their fat mass, their muscle mass, and just their total weight. Everybody over 40 had a bone density scan. Well, we'd have a giant rash of increased cases of osteopenia and osteoporosis, because there are a lot of people out there unaware that they've got low bone density. Now, it's not as big of a problem in males for the most part, but that's not to say it doesn't happen. And every once in a while we see that. And so I think there'd be a lot of males surprised out there as well. I think in general, people would probably be shocked by the overall lack of muscle mass. Hopefully, those two things, the bone density and the lack of muscle mass, would encourage people to get in and lift heavy things a few times a week. But I mean, as far as the fat mass goes and the visceral fat, I'm sure we know that it's going to be present in the majority of the American population. So yeah, I don't know. I would hope so. I would hope it would spur a national uprising and drive towards health and demand that our food is good and that we all have enough time. We're granted exercise breaks at work. We create a revolution for health, but I don't know. I haven't seen one of those in the history books yet.